Hello, and welcome to this overview and demonstration of the new National Outcomes Measurement System, or NOMS, for SLP healthcare. Today, we will highlight the changes and new features included in this latest version of NOMS and show you a preview of the web-based data collection tool. This latest version of NOMS has several new enhancements. One is the expanded age range and the inclusion of new populations. With this new release of NOMS, you will be able to enter any individual who is at least 3 years of age into data collection. Additionally, previously excluded populations, such as school-aged children and adults with developmental disabilities, can now be a part of NOMS. We have also added 2 new proxy roles to assist organizations with NOMS data collection and management. Anyone designated as a subscriber proxy can run data reports for the organization, upload data, or add or remove facilities and users. Clinician proxies can enter patient data into the web-based tool on behalf of clinicians within their organization. We have also added some new questions. For adult patients scored on certain functional communication measures, or FCMs, you will have the option at the time of discharge to indicate what specific treatment targets or aims you worked on during treatment for that particular FCM. Other new questions ask if the individual or caregiver was provided counseling on managing safety concerns, and if any of the SLP services were provided via telepractice. One of the biggest changes you will notice with the new NOMS is the functional communication measures. The FCMs are no longer 7-point scales. Instead, each FCM is a series of domain-specific questions that you rate, and a total score for that FCM is returned to you. These updated FCMs are easier to score and provide more granular information and give clinicians a more complete understanding of their outcomes. The questions for each FCM vary, but typically focus on how well the individual completes a functional task, how often they exhibit a particular problem, how they perform in different situations or under different demands, and how often they need supervision or assistance in excess of chronological age expectations. Another new feature is the ability to enter patient-reported outcomes, or PROs. These optional PROs directly assess how the individual feels about their communication, cognition, or swallowing abilities before and after treatment. Depending on the individual's age, you will have the option to submit 1 or more PROs completed by the individual or their proxy at admission and discharge. In addition to the regular PRO questions, on each discharge PRO form, we have added several questions to assess how satisfied the individual was with the services they received. These include questions about if the individual felt they were involved in treatment and how well they understand their problem. A key benefit of NOMS is the data reports. The new NOMS data reports have been greatly expanded and are now more robust and flexible in the types of data you're able to view and the types of analyses you're able to perform. They also have greater benchmarking capabilities. So for organizations that have more than one facility, you will now be able to benchmark an individual facility's performance not only against national data, but against your organization as a whole as well. You can schedule reports to be run at a future date, and you will be alerted when that report is complete so that you can go and view and download it. You can save customized templates and download any data set from a report so that you can do your own analyses outside of the NOMS system if that's what you would prefer. With the new NOMS system, we will continue to have multiple options for submitting data. You can submit via the web-based portal. You can build NOMS into your electronic health record and transmit data to DASHA either through JSON or CSV files. But we've also added a new NOMS app for organizations using Epic or Cerner as their electronic medical record. If your organization is FHIR-enabled and uses either Epic or Cerner, this app makes integrating NOMS into your medical record seamless and easy. The NOMS dashboard has also been expanded. This easy-to-navigate dashboard is the hub for entering data, running reports, and managing all your facilities and users. So let's go take a look at the dashboard now and run through a demonstration of web-based data collection. Once you sign into the NOMS system, you will be taken to your NOMS dashboard. At the top of the dashboard is identifying information such as the name of your organization, your name, and the role that you are logged in under, such as clinician or subscriber. If you would like to switch between those roles, just use the Switch Profile feature. Also at the top of the dashboard is information regarding compliance, such as how recent your last submission to NOMS was, and if your certification and membership has been maintained with ASHA. We also have a spot at the top for data teasers or snapshots from your report that compare your organization's outcomes to those from the national data. As you scroll down, you can see an overview of your records that you have submitted to NOMS. Each of these widgets is clickable and leads to a filterable list of your admitted records, your discharge records, any forms that you have started, admission or discharge, but have not completed, and any records requiring updates. This is a feature with the new release of NOMS in that any individual who has remained on a caseload for greater than a year, we are asking that you discharge that individual from NOMS, and if they will continue to receive services, to readmit them back into data collection. So this widget alerts you to any records that have been open or admitted for at least a year. As you scroll down, you see a list of your most recently modified records. You can sort them by record ID, by FCMs. If you hover over the record number, you will see information about that individual, such as their age and gender, race, ethnicity. So each of these columns is sortable, and you can take some actions on a record here depending on the record status. However, most of the navigation you will do will come from the left-hand side of the dashboard. From here, you can access the patient records, either yours or all records at the organization. And from here, you can create a new record or, again, take action on any incomplete records. From the facilities section of the dashboard, you can, again, sort facilities by name, city, state, by the number of records, and you can favorite a facility, and it will appear at the top of your facility listing when you go to submit a record. You can add a record to a facility or start a new report. Also on the left-hand side are links to the NOMS user guide, which provides an overview of the training and how to navigate around the dashboard, as well as the forms for the patient-reported outcomes that you can download and print and hand to individual patients or their proxies for them to complete. There's also a way to contact ASHA NOMS staff should you need assistance. So let's walk through entering a patient into NOMS data collection. From the Patient Records tab, you select Create a New Record. From the drop-down list, you'll select the facility from your organization that the patient is being seen at. As you can see, my favorited facility is at the top of the list. Once I am in, I enter basic demographic and information about the setting. Some options are multi-select, and some are single select. Under the Diagnosis tab, I have the option to enter up to 25 ICD codes. There's a type ahead feature for this, so I can start by entering the code, and some options will come up. Continue with the information about the diagnosis, the time post-onset. I enter in any information about the individual's SLP diagnosis or conditions. Here's two new questions that have also been added. They ask if the individual has hearing loss or a cognitive or intellectual disability. And then you're taken to the functional status section where you can score either FCMs or PROs or both. From my dropdown, I can select an FCM to score and click Add. At the top of each FCM are some instructions, definitions, and notes for scoring that you should refer to before continuing with the FCM. Each FCM is a series of questions. For this one, is how often does the individual demonstrate adequate cognitive communication skills to independently complete rote or simple routine living tasks? We rate what percentage of the time the individual is able to do that. complete age-appropriate common daily living tasks. Again, what range of time is the individual able to complete that? Complete age-appropriate complex living tasks, and again, we give some information there about what that includes. And function safely without additional supervision or assistance. So you can see for this construct at the end, the scoring is reversed, whereas these would indicate better performance. Here, it indicates worse performance. So be alert for those types of switches. You can click to add another FCM, or you can go back up to the top and complete one of the optional PROs. So for this one, let's add the NeuroQual. The first question is going to ask you how this was administered. And then you will enter the items that the person checked on the paper form that you gave to them. So we'll click through here and put some responses in. And at the next window, you can see that everything's been completed and ready to go. So once you hit submit, you will receive this little modal. It will give you key information that you should copy into the medical record or keep. It gives things like the NOMS patient record number, which should be used for completion of the discharge form. It gives you a score for the FCM, and it also gives you a score for the PRO. Again, so you can copy this information to a clipboard and include in the record, or simply close it out and return to the dashboard. Once you return to the dashboard, you will see that your most recently submitted record is the one at the top. Other records you will see also have other statuses. So this one has an incomplete admission, meaning we can't add a measure, discharge, or admit. We can only continue with the admission form. For the one we just admitted, it gives us the option to either add a measure or discharge. This add a measure lets you add an additional FCM or PRO after the admission form has been submitted. So let's go in and add a measure. Okay. Again, we select the FCM we would like to score and hit add. And once again, we have definitions and special notes for scoring. Again, we're asked how often the individual can do certain things under certain levels of demand, such as low demand and high demand. Once that measure is completed, I can review. I did not add any PROs, but I could at this point as well. And I submit. And once again, I'm going to see this modal pop up with the same record number, but now a new FCM score for spoken language expression. So if I close this and go back to my dashboard, I still have a status of admitted. I can add another FCM or PRO, or I can go to discharge. Let's run through the discharge form. Upon entering the discharge form, you're taken immediately to the FCM section. And so here's all the same questions you answered at admission about the individual's cognitive communication skills. So we'll scroll down here, do that. Then we have questions about service delivery under cognition, and you can see here we ask about the managing safety, counseling for managing safety concerns for the individual, what the predominant service delivery model was, if treatment goals were met for this FCM, and was there a structured home program for this? And if there was, how much of it did they complete? Here's where you also have the option to enter treatment aims or targets. So what exactly did you work on with this individual? Perhaps it was divided attention, perspective memory, and some executive function. You can also add other and use a type in. So you would select all that apply here for that individual. Same goes with spoken language expression. Again, you're going to respond to all the same questions you did at admission. Answer questions about the service delivery. And down here, you will enter how much treatment time you spent on each FCM, which must add up to 100. Now, at this point, let's say I get called away, but don't want to lose all the information I've just entered. I can hit save and exit. I will be given the NOMS record number again, and I can close that, and you can see I now have an incomplete discharge. So when I come back, I would still have the option to add a measure because the discharge form has not been submitted, or I can continue with my discharge form. So if we go back into the discharge form, you will see that I forgot a question here, and it will alert me to any sort of missing questions that I have. So if I go back in here to find the missing question, I can complete. Now I come in and I'm going to talk about the discharge considerations that we had and the reasons for discharge. So as I mentioned earlier, annual NOMS update is a new reason for discharge. So if I indicate that here, what the system's going to tell you is that if you're submitting via the web portal or the NOMS app, that a new admission form is automatically generated for you at this point for you to go back in and review and submit after you finish discharging this individual. And if they're not going to continue to receive services, you can either discharge that admission form, but what it does is it carries over key information like FCM scores and basic demographic information so that you don't need to re-enter that. You'll answer if continued services are recommended, primary funding. Many of these questions should seem very familiar, and answer questions about dosage. So because this person was in over a year, we will put in a long length of stay. You're going to enter the number of individual sessions and group sessions, enter if any of these were delivered via telepractice. Again, one of the new questions. How often did the individual receive services? How long were those sessions? And for those group sessions, what was the size of the group? Once I go into next, I can see that my functional status questions have all been answered. My SLP services questions have been answered, but you know what? I forgot to put in the PRO that I did previously. So I can go back there and fill in the PRO questions that the individual or their caregiver provided. And these are the NeuroQual questions. And as you can see, the difference is with the discharge version of the PRO, or here's the satisfaction questions that we talked about earlier. So you can give these to the individual and they can indicate how satisfied they were with the SLP services. You can also add a PRO. Even if you didn't score the PRO at admission, if the individual completes a PRO at discharge, you can also enter that in because these are optional. They can be entered at any time. And again, the submit button becomes live so that you can submit from any of these tabs. And once you hit submit, you're given your summary of your FCM scores as well as your new PRO score. Again, copy to clipboard, or if you close and return, you'll see that you're taken right back to your dashboard. Now, for this individual, you can see they don't have a status of discharge. Instead, they have an incomplete admission status because a new admission form was automatically generated for them. So if we go back into that form, you can see that the age is not filled out because the person's likely older than the first time, but basic demographic information and functional status information. I need to enter an age. So functional status information is all complete as well. So you can simply review that and resubmit, and that individual will be admitted back into NOMS. So this is a quick overview of NOMS. As always, if you have any questions for us, reach out to us at noms@asha.org. And we look forward to you participating in this next version with us. Thank you so much.